I really am very keen to ask you about the national plan that is based on the Doherty modelling.
Sure, of course.
So the idea that we open up at 70 or 80%, there's many different versions of opening. I know you know the modelling better, I'm sure, than most people listening. But whether or not the contact tracing is optimal or not dictates how often we are likely to have lockdowns. And the modelling says that even at 70% double dosed, we will have harsh lockdowns half the time if our contact tracing is not optimal. So I wanted to ask a specific question. Is New South Wales contact tracing optimal right now?
I think it is. It's this notion of seeking and trying to find every case, and I'll let them discuss and comment on their own achievement of that. But they are a world-class contact tracing system. Now, with numbers this high, it is a challenge, but I have to say that I think it is an outstanding system, and I've been doing the work with Professor Jodie McVernon, who was, in fact, I think, briefing the National Cabinet this afternoon. And, their view is that New South Wales is doing an excellent job, as I think it's...
Can I be really picky, Greg Hunt? There might be a difference between excellent and optimal. So within the context of the Doherty modelling discussion, there's two sorts of tracing, optimal and partially effective. Are you saying that you think it is optimal right now?
I think it is doing an excellent job, and you're wrong, with great respect. It's not a one or the other. Those are model scenarios, but it's a graduation. And in terms of the process of tracing, of focusing on critical nodes, it's doing those things. And so it is achieving, very significant outcomes. Always, though, and this is something we committed to in February last year, it's this process of continuous improvement.
Oh, sure.
And that's what all of the states and territories are doing.
Can I drag you back to the
result is very different to last year. So the Doherty modelling settings were reaffirmed only last night.
I'm not saying there's anything wrong with the modelling, Minister. I do want to ask you. There's
Jodie McVernon.
There's a specific reference on pages 36 and 37 about at 70% double dosed, a partially effective contact tracing system means you're likely to have lockdown half of the time. But you're saying that is not the case, that your interpretation of the modelling is that New South Wales and Victoria are at optimal tracing. Is that correct?
I think they are in a situation where they're achieving the vast bulk of the outcomes they're setting and aiming to do. There's a lot more to do, obviously.
Sure.
But I know you see this all presented as binary. It's not. What it is a graduation, and then there are multiple factors. The vaccination, which doesn't stop at 70. Already New South Wales is at 70 and continues on.
Well, it's 71 doses, aren't they? Not 72 doses.
Achieve the 80%.
Yeah.
Yes, I am confident. Am I confident Victoria will achieve that? Yes, I am. And at the same time, you also have the public health measures, and you also have testing and tracing.
Yes.
And the other thing is that as vaccinations increase, you're likely to see
hopefully
a decrease in case numbers on the advice that we have. Now, none of us can say forever.
Sure. Can I ask another contact tracing question, Greg Hunt?
Yes.
I think some people are perturbed. In New South Wales, they're not always getting a phone call now when they are a positive case. Clearly, it changes when you have, more than 1,000 cases a day. Are you okay with no actual phone call with someone who is a positive case? Do you think that's just something we need to accept?
Well, I think that I would want to check that very carefully, because the latest briefing I had from our team last night and from indeed the Health Ministers' meeting is that New South Wales was focusing on every single positive case, and they have had an outstanding record. So I'd just be very cautious.
Okay, I'm going off reports there. I haven't asked that question.